Hello everyone, today we will present the result of our work on the HIV virus. And before we start, let's hear some opening speech from our chairperson Fatimah Azahra. The time is yours.
Thank you, Farrell. Hi, everyone. I hope you're all doing well today. I am here just to tell a few things for you to know what we are doing. So, this project took one chapter in the semester, which is virus. Students have to determine one virus that they will examine and studied, and then present it as a result of this project. And HIV/AIDS is the case that they have chosen. They also have spent few time studying the disease, medicine, technology, and the virus itself. The presentation you are seeing now is actually based on our desire to create more thorough learning. We don't want students just to spend their time in exam papers or recite the material whole night long like the old generation used to do before their exams, right? So, from this project, getting students directly involved with the subject material, with the examination, we hope that they can understand and not just memorizing, even worse, if it's only for grades. So, in its formulation, this project is not only intended for the subject matter itself, but also to foster a sense of responsibility among the students as the people who have the knowledge, and in this case, about the HIV/AIDS virus. So, students not only learn about the viruses, but also learn to carry out the responsibility to educate the others who don't have the knowledge basics or the understanding about this virus. And that's also why we decided to upload this presentation in our social media, Club of Science and Social, so that we can educate other people while studying with our friends in this club. So I hope you enjoy the presentation, and let's move on with the medical team and their research about HIV virus. Thank you.
Okay, thank you for the opening speech. Let's move on the presentation. My name is Farel Satria Bizar as epidemiology.
Hello everyone, my name is Sabina Ferozia as doctor.
Hello everyone, my name is Erene Zakira as pharmacist.
Hello everyone, my name is Sofiani Pasha as primary care provider.
What is HIV or AIDS? Human immunodeficiency virus, or HIV, is a virus that infects and destroys humans' white blood cells, or CD4 positive T cells, which cause a decrease in human immunity. HIV symptoms. Some people have flu-like symptoms within 2 to 4 weeks after infection, or called acute HIV infection. The symptoms may last for a few days or several weeks. Possible symptoms include fever, chills, rash, night sweat, muscle ache, sore throat, fatigue, swollen lymph nodes, and mouth ulcers.
HIV can be transmitted by sex, use of drinks, pregnancy, childbirth, or breastfeeding, and blood transfusion. HIV transmission can occur through unprotected sex, be it vaginal, anal, or oral sex. In addition, someone who likes to change sexual partners is also more at risk for getting HIV. HIV can be transmitted through needles that are contaminated with the blood of an HIV-infected person. Sharing needles or using used needles puts a person at a very high risk of contracting disease, including HIV. A mother who is infected with HIV and pregnant or breastfeeding is at high risk for transmitting HIV to her baby. It is important to consult a doctor if you are an HIV sufferer who is pregnant so that the risk of transmitting HIV to the baby can be reduced. In some cases, HIV transmissions can also occur through blood transfusions. However, this incident is increasingly rare due to the implementation of donor eligibility tests, including blood donors, organs, or body tissue donors. With proper testing, recipients of blood donors have a lower risk of becoming infected with HIV. Next. HIV does not survive long outside the human body, and it cannot reproduce outside a human host. It is not transmitted by mosquitoes, ticks, or other insects, through saliva, tears, or sweat, by hugging, shaking hands, sharing toilet, sharing dishes, or close mouth or social kissing with someone who has HIV. Through other sexual activities that don't involve the exchange of body fluids, for example, touching, and lastly, through the air. Next.
Prevention. One, use a condom every time you have sex. If you don't know your partner HIV status, use a condom every time you have vaginal, anal, or oral sex for women. You can use a female condom. Two, avoid risky sexual behavior. Anal sex is sexual activity that has the high risk transmitting HIV. Precautions and retrievers of anal sex are both at risk contraction HIV. Only recipients of anal sex are at high risk. Therefore, it is advisable to have safe sex and use condom to prevent HIV transmission. 3. Avoid using used needles. Avoid using used needles when injecting medication. Transmission of HIV to tetanus and pregnancy is also a risk if you use tetanus needles that are not sterilized before of use contamination tetanus ink before getting a tetanus or preaching. Make sure the needle is still sterile. 4. Perform pre-exposure prophylaxis. Is made of prophylaxis IV by talking antiretroviral for those who are at high risk of contraction HIV, namely one who has more than one sexual partners, two who has a partner who is HIV positive. 3. Injection needles user who are at risk in past 6 months or those who have frequent unprotected sex. Stage. When people with HIV don't get treatment, they typically progress to 3 stages. But HIV medicine can solve or prevent progression of the disease. With the advancement in treatment, progression to stage 3 is less common today than in the early days of HIV. Stage 1. Act to HIV infection. People have a larger amount of HIV in the blood. They are very contagious. Some people have flu-like symptoms. This is the natural response infection, but some people might not feel sick right away or at all. If you have flu-like symptoms and you might have been exposed to HIV, sex medical care and ask for test to diagnose active infection. Stage 2, chronic HIV infection. This stage is also called asymptomatic HIV infection or clinical latency. HIV is still active but reproduce just at very low levels. People might not have any symptoms or get sick during this phase. Without taking heavy medicine, this period might last a decade or longer, but some might longer faster. people can transmit HIV in this fase. At the end this fase, the amount of HIV in the blood goes up and the CD4 cell count goes down. The person might have symptoms as the virus levels increase in the body and the person moves into stage 3. People who take heavy medicine is prescribed might never move in stage 3. Stage 3, accumulation immunodeficiency syndromes. The most severe phase of HIV infection. 1. People with AIDS have such body immune system that they get an increasing number or several blindness called opportunistic infection. 2. People reverse an AIDS diagnosis when their CD4 count drop below 2000 cell, or if they develop certain opportunistic infection. 3. People with AIDS can have a viral load and be very infection. Without treatment, people with AIDS typically survive about 3 years.
Treatment. HIV cannot be cured until now. However, there is an effective treatment of HIV infection if it is started immediately and regularly taking antiretroviral. Antiretroviral are used to fight HIV infection by blocking the reproduction of HIV in the body from entering the AD stage. Antiretroviral work by slowing the multiplication and spread of the HIV virus in the body by interfering with the replication process in various ways. Next. There are 3 groups of antiretroviral. The first is nucleotide reverse transcriptase inhibitors. This group of drugs inhibits reverse transcriptase by preventing the process that duplicates the genetic material of the virus. The second is non-nucleoside reverse transcriptase inhibitors. These drugs inhibit reverse transcriptase by preventing the process that duplicates the genetic material of the virus. And the last is protease inhibitor. These drugs interfere with HIV replication by binding to the reverse transcriptase enzyme itself. Thus, the enzyme is prevented from working and stop the production of new viral particles in the infected cells.
Okay, now let's move to the personal driving question. The first question is, how you will react when you heard about the virus for the first time? The second question is, what will you do when you realize the virus starts spreading around? The last question is, what role you choose and explain what you can do as that role.
One, as a figure what is cross the community and become a direction example in community. I can provide education to them first. For example, how are the dangers impact and why to prevent the HIV virus. 2. First, take care of self because as doctor we can tiny know how to protection ourselves from virus and also avoid illegal drugs because HIV and AIDS can also be transmitted through the use of unsterile needles. 3. I choose doctor as my role. All I can do as a doctor is treat and prevent virus that can record.
For the first question, when I heard it, I will immediately find out about the virus and look for weakness in order to weaken the virus and make a vaccine. For the question 2, I will researching virus and finding the problems that can make them spread quickly and researching drugs that contain ingredients to weaken the virus. And for the last question, I choose pharmacist as my role. All I can do as pharmacist is researching drugs and ingredients that might weaken the virus and making vaccine.
My answer for the first question is, when this virus appeared, the first reaction I experienced was worry, because this virus is not a virus that can be taken lightly or weakly. Second question, what I will do when this virus spread is find the cause, how to prevent it, and study the pattern of this disease. And for the last question, my answer is, for the role I chose is an epidemiologist. My task is to analyze the spread of the HIV virus and describe the pattern of disease into the public.
When I heard about HIV for the first time, I was shocked and worried about it. I immediately think about the best way to handle it so the virus doesn't spread around so quickly. And I will do my best to treat the people who has been infected by the virus. And for the role, I choose primary care provider as my role. As primary care provider, I can prevent, diagnose, and treat the virus.
And now let's move to the last part, teams driving questions.
One method then can be used to treat the HIV virus, such as 1. Exercise routine, 2. Get straight of HIV regulation, especially for someone who is sexual activity. 3. Avoid direct contact with birth, even if it foreign and situation is not possible. Use protective equipment when treating injured people, such as protective clothing, Google and Max. First, have safe sex. Use safety device such as condom during sexual intercourse. 5. Avoid changing partners during sexual intercourse.
Second question, what medicine suits the best, or will you guys make the new one? Our answer is, unfortunately, there is still no medicine for this disease, but there are treatments using antiretroviral for someone who already infected with HIV. The treatment of HIV or AIDS with medicine is called antiretroviral therapy or ART. It's recommended for everyone who has HIV. The medicines don't cure HIV infection, but they do make it a manageable chronic condition. They also reduce the risk of spreading the virus to others. How do HIV or AIDS medicines work? HIV or AIDS medicines reduce the amount of HIV or viral load in your body, which helps by giving your immune system a chance to recover, even though there is still some HIV in your body. Your immune system should be strong enough to fight off infections and certain HIV-related cancers, reducing the risk that you will spread HIV to others. What are the type of HIV or AIDS medicines? There are several different types of HIV medicines. Some work by blocking or changing enzyme that HIV needs to make copy itself. This prevents HIV from copying itself, which reduces the amount of HIV in the body. Several medicines do this. The first one is nucleoside reverse transcriptase inhibitors. Block an enzyme reverse transcriptase. The second one is non-nucleoside reverse transcriptase inhibitors, or NNRTI, bind to and later change reverse transcriptase. The last one is integrase inhibitors, blocks and enzyme integrase. Protease inhibitors, or PAS, block and enzyme protease.
For the third question, what kind of technology your team will use for handling this epidemic? Until today, HIV is still a virus that is difficult to destroy, but lately we found a technology to destroy HIV. We have successfully carried out HIV eradication in living mice for the first time. We use a combination of gene editing technology, CRISPR treatment for this experiment. We think this study is a big breakthrough because for all this time, HIV has had no cure. CRISPR-Cas9 is a gene editing that has been modified with certain technologies to help researchers treat and even completely cure gene disease. This technology can be used to alter human DNA, such as deleting and altering certain genetic material. Meanwhile, laser art is a super form of ART therapy that can keep the virus from growing for a longer time. ART is stored in the form of nanocrystals. We will first immerse the laser art, then use CRISPR to kill the virus that the ART frozen. Although there is still much to improve, we believe this technology will be very useful for humans in the future.
And for the last question is, if you have the power to make a call for the country, what will you do? We hope the government can support this recently discovered technology. We use a combination of gene editing technology and laser art therapy treatment for this experiment. CRISPR is a gene editing technology that has been modified to help researchers treat and even completely cure gene disease. Although there is still a lot to improve, we believe this technology will be very useful for humans in the future. We also hope to get full support from the government on the importance of educating the public about methods that can be used by the community in order to prevent the transmission of HIV or AIDS. We have worked closely with the government to provide education to the public. Keep in mind, HIV is transmitted through contact with infected blood, semen, and vaginal fluids from an infected person. Therefore, we will remind again the importance of having safe sex and always use safety devices such as condoms when having sexual intercourse, because condoms are the most effective form of protection against HIV and other sexually transmitted diseases. And avoid changing partners during sexual intercourse, because a person can be exposed to sexually transmitted disease without knowing it. In addition, by not using illegal drugs, because the HIV can be also contracted through unsterilized strings, because HIV can be transmitted through blood. So sharing needles can increase a person's risk of developing this disease. We have also increased access to service for people living with HIV, and for pregnant women, if you're worried that you may be infected, get tested immediately and seek for medical treatment.
That is all for us. Thank you so much for coming. I would like to apologize if there is a mistake. I hope you guys have a nice day.